Mr. Tan had just undergone a heart surgery, and now he is wondering how should he care for the wound? What are the do's and don'ts? During a heart surgery, there is an incision made in the center of the chest wall which cuts through the breastbone or sternum. The bone will take 2 months to completely heal. Hence, during the first 2 months, Mr. Tan is discouraged to do any heavy work or carrying of heavy loads which may affect the healing of the breastbone or sternum. He also needs to be careful as stretching the wounds too much may cause them to tear or bleed. Mr. Tan is encouraged to gradually increase the amount of work or exercise to allow the heart to recover well. He must also remember not to resume or increase the exercises or activities of daily living too quickly, as this can tire him out, slow down his recovery, and increases the risk of developing complications. For the care of his wound, Mr. Tan's physiotherapist has advised him to keep his wounds clean and dry. During showering, he is to gently wash his wounds with warm water and soap. Mr. Tan is also advised to seek medical treatment if his wounds have any discharge or bleeding. He is also discouraged from using lotion or medicated oil. As coughing and sneezing can cause a pulling pain in his sternal wound, Mr. Tan was taught to cross his arms in a self-hugging posture with a pillow to reduce pain as it provides compression and helps to protect his chest wound. If a pillow is unavailable, Mr. Tan can just cross his arms in a self-hugging posture to brace his wound when he coughs or sneezes. Mr. Tan is also encouraged to open his mouth wide to have a stronger, effective cough. To reduce the risk of any injury to the wound while getting in and out of bed, Mr. Tan has been advised to follow these steps slowly. To get out of bed, Mr. Tan needs to, first, open one of his arms sideways to avoid rolling onto it. Then, he will need to roll onto his side, using his leg and other arm. Next, he will have to sweep both of his legs over the side of the bed, followed by slowly pushing himself up using his elbow and hand. After reaching a comfortable angle, he can change from using his elbow to using both hands to gradually push himself into a sitting posture. Now, to lie down, Mr. Tan needs to, first, sit far back from the edge of the bed and position himself closer to the head of the bed to ensure that he will be in a comfortable position after lying down. Next, he will need to place both hands at the side of his body. He will then need to slowly lower himself down sideways with his hands while lifting his legs onto the bed. After lying down sideways, Mr. Tan can roll onto his back, hugging his chest. To improve blood flow and prevent formation of blood clots in the legs, Mr. Tan has been prescribed with a pair of anti-embolism stockings by his physiotherapist. Mr. Tan has to wear the stockings daily for 3 to 4 weeks after surgery, but he is allowed to take them off once a day for showering and cleaning. Mr. Tan is allowed to fold the front of the stockings when he is wearing slippers, but it should be folded back down when he is not. It is important for Mr. Tan to take note of the proper usage of the anti-embolism stockings. Mr. Tan is advised not to roll the stockings down as it will form a tight band around his legs. This can be dangerous as it constricts the blood flow and cause skin sores. Mr. Tan should also take off the stockings once a day for hygiene purposes as well as to check the condition of his skin and blood flow. Mr. Tan has also been told to be alert to any numbness, pins and needles, pain, or soreness in the foot or leg. This may be a sign that the stockings are too tight. Should he develop any pain or discomfort, bruising or blisters, he should remove the stockings and seek immediate advice from his doctor or nurse. To care for the stockings, Mr. Tan should hand wash them with cold water and soap before laying them on a flat surface to air dry. To avoid damaging the stockings, Mr. Tan should not place them in a washing machine, under direct sunlight, or hang them up. For the first 2 months after the surgery, there are some activities that are safe for Mr. Tan to perform and some that are best to avoid. Some activities that are considered safe for Mr. Tan to perform are carrying objects less than 5 kilograms, working on the computer, light cooking, taking a shower, going for walks with his family, and doing light exercises. On the other hand, Mr. Tan should avoid performing any strenuous activities such as carrying objects more than 5 kilograms, reaching for objects above his shoulders, carrying heavy pots, doing heavy housework, bathing in a bathtub, climbing more than 3 floors at once, swimming, playing contact sports, running, playing golf, driving a car or riding a motorbike, doing tai chi, doing or putting out laundry by hand, and using upper limb exercise machines. Now that you have seen what Mr. Tan can and cannot do after his heart surgery, let's move on to see how exercise can help you. Exercise is an important component in your recovery after heart surgery. The benefits of daily exercise include improved stamina, reduced shortness of breath, reduced symptoms of fatigue, improved muscle tone and strength, improved balance and joint flexibility, lower blood pressure, loss of body fat and body weight. Every exercise session should include 3 phases, which are the warm-up, conditioning, and cool-down phases. The warm-up phase is the first phase of exercise and it usually takes 5 to 10 minutes. Warming up prepares the body for exercise while reducing the risk of injury to your muscles and joints. The freehand exercise and stretches will gradually increase the workload of the heart and reduce the risk of developing chest pain and abnormal heart rhythm. Conditioning phase is where you perform the actual exercise, usually for 10 to 30 minutes. Aerobic exercises are recommended for this phase, starting with walking on discharge. This eventually may progress to include cycling, swimming, or jogging as you recover, but do clarify with your doctor or physiotherapist first. After you are discharged from the hospital, start off slow and gradually increase your exercise time as you progress. Cooling down for 5 to 10 minutes allows your body to recover from the conditioning phase. This prevents blood from pooling in the legs, as well as muscle soreness and tightness. Take a slow walk or do some stretching to return your heart rate and blood pressure to resting levels after the cool down. Some important pointers to take note of when exercising. Do not sit, stand still, or lie down immediately after exercise, as this may cause dizziness, lightheadedness, or palpitations. Do not exercise if you're not feeling well. Exercise during the cooler times of the day. Wear light, comfortable clothing during exercise. If you are unsure, do check with your doctor before starting any exercise program. If you experience any movement in the sternum, accompanied with a clicking, cracking, or popping sensation, please stop your exercise and seek advice from your doctor immediately. You should feel comfortable while exercising, and it is important to know when to stop exercising. Stop all exercise if you experience any symptoms such as chest pain, giddiness, difficulty in breathing, and excessive cold sweat. It is normal to breathe faster and harder during exercise, but your breathing gets increasingly difficult when you exercise too hard. You are exercising at the correct intensity if you are able to slowly count from 1 to 15 without stopping more than 2 times to catch your breath. The resting pulse rate, or RPR, is the rate at which the heart beats while you are resting. To measure your RPR, place 2 fingers on your pulse near your wrist and count the number of beats within 10 seconds. Multiply this number by 6 to get your RPR. When exercising, your pulse rate should only exceed your RPR by a maximum of 20 beats. For example, if your RPR is 80 beats per minute, your safe exercise pulse rate should be less than 100 beats per minute. You are advised to take your pulse rate before your warm-up, at regular intervals during your walk, and 5 minutes after cool down. The rate of perceived exertion scale is used to gauge if you are exercising at the right intensity. The desired range during an exercise is between 11 and 13 on the scale, and you should feel that you are exerting yourself fairly lightly or somewhat hard. Aerobic exercises are recommended as they help to improve the stamina of your heart and muscles. Walking is the easiest aerobic exercise for you at this point in time. Here are some pointers for patients with diabetes. As your body burns more sugar to give you energy during exercise, the combined effects of physical exertion and diabetic medication may lower your blood sugar level during or after exercise. If your sugar level is lower than the recommended range, eat a piece of fruit before you exercise. Do not exercise if your level is above the recommended range. Patients with diabetes must stop exercising if they experience the following symptoms. As low blood sugar may occur at any time during exercise, it is a good practice for patients with diabetes to always carry a carbohydrate snack with them, such as a piece of fruit. Those who do not have a glucometer to check their blood sugar level may exercise 2 hours after a meal to be safe. Patients with diabetes may also consume a meal rich in carbohydrates after they exercise to replenish their blood sugar level. Here is an example of an exercise guide from week 1 to 5. Starting from a 10 minutes walk in week 1, you can gradually increase your walking duration by 5 minutes weekly. Exercise at your own pace, and if you feel tired, progress at a slower rate. Now, let's get started on some exercises that you can do for warm-up and cool-down. For warm-up, you should start with shoulder exercises, then finish with your leg exercises. For cool-down, you should start with leg exercises and finish with shoulder exercises. Repeat all exercises for 5 to 10 times. You may do the exercises while sitting down if you have difficulty doing them in standing position. Shoulder shrug. Move your shoulders up and down. Shoulder stretch. Place your left arm across your body and push inwards. Hold for 5 seconds. Repeat with right arm. Shoulder rotation. Place your hands on your shoulders and move your elbows in a circular motion. Shoulder flexion. Slowly raise both your hands up and down. Elbow flexion. With your arms at the side, bend and straighten both elbows. Truncal rotation. Slowly turn your trunk to reach across your body for both sides. Truncal side flexion. Bend your trunk sideways towards the left, followed by the right. Knee extension. Straighten and bend your left knee and then repeat with your right knee. Ankle pumps. Move your feet up and down. This exercise will promote good blood circulation. This is the end of the video, and we hope that it has provided you with enough information to assist you in your recovery. If you have any questions, feel free to consult your physiotherapist for further clarifications.